I like your timekeeping. Just as a background, the talk today is basically on community emergency care. It's obviously something that needs to be developed in Kenya, and we're very fortunate to have Dr. Wachira with us, and I'm sure he's going to give us more information. As we go through the talk, I just basically wanted to say it's something that's fairly new in Kenya, even though we may think, I mean, I always thought it existed, but actually clearly it doesn't. And having read more about it, I think it's such an important thing that we have in our communities, especially during this last 2 years of the COVID pandemic, where most of the attention has been given to COVID patients to the detriment of other patients, because most of the beds spaces are usually more or less allocated to COVID patients. And, you know, in case of an emergency, we find ourselves without knowing what to do and who to call. So it's just basic things that we could do while at home, while waiting for help from a medical doctor, or while transporting the patient to the hospital. These are very important things that could keep the patient alive, or, you know, save 1 or 2 or 3 people. So it's so important that we know what to do during an emergency. And please take as many notes as you can. Dr. Wachira is also going to share with us an app that has been developed. And in case of an emergency, it would be something very important and handy to have. We're also going to have the YouTube video, which I would encourage as many of you to share with your family and friends, the ones who have not been able to join us today.
Thanks, Lynette. That's a very good introduction. You're muted, Lynette. I can't hear you.
I'm just going to check if there are more participants on YouTube, because
All right,
I
no
think
problem.
some people are more comfortable.
Not a problem.
Okay. Hello, everybody, and just give me a second. Sorry, everybody, about the delay. We're having some technical issues with the YouTube link, but I don't want to have to waste any more of Dr. Wachira's time because I understand he's still on duty. Thank you, everybody, once again, for joining us. And I just want to give a shout out, obviously, to the Goen Institute for the platform that they have provided to us to be able to bring this information to the community. Today, we're privileged to have with us Dr. Benjamin Wachira. I'm going to just read out his brief CV, which is highly impressive for somebody who is quite youthful, if I can put it that way. Dr. Benjamin Wachira is an assistant professor of emergency medicine at the Aga Khan University, Nairobi. He's the current president of the African Federation of Emergency Medicine, an international association aimed at supporting emergency care development across Africa. He's also the founding director of the Emergency Medicine Kenya Foundation, which is an organization dedicated to ensuring timely, accessible, and quality life-saving emergency care in Kenya. As the International Federation of Emergency Medicine Regional Board Representative of Africa, and currently the only qualified Kenyan emergency medical physician, Dr. Benjamin is playing an instrumental role in developing emergency medicine in Kenya, as well as throughout Africa and extending across the world. Today, he's here to inform us of what he's doing in Kenya and to introduce us as well to the use of an app that he has put together to basically help communities whenever we have emergency situations. Over to you, Dr. Benjamin, and thank you so much for gracing us with your presence.
All right, thank you very much, Lynette. And thank you for the great introduction. And no, I'm not doing all this alone. There's a whole team that works behind these organizations to ensure that we have easy access to emergency care across Kenya and across the continent. As correctly introduced, I'm the immediate past president of the African Federation for Emergency Medicine, but locally work with at the Aga Khan University Hospital, but also with the Emergency Medicine Kenya Foundation. The key thing for me has always been the passion is to develop emergency care in the country, because I think it's something that has been neglected for many years, and we've lost a lot of lives. And I'm sure if I was to ask each of you to relate to an emergency situation, I'm sure you will quickly flash in your mind something that happened, and hopefully the person survived, but in some instances, unfortunately, we tend to lose a lot of people, where simple emergency care would potentially have saved the situation. Plaguing our country is lack of a public ambulance system. We don't have the 999, the 911 that works to access an ambulance service. Most of the ambulance services are private, so you have to pay out of pocket. But even with that, I'm sure if I was to ask any of you, if you have an ambulance number on your phone, I'm sure I can see Lena shaking her head, so that means she has no ambulance number. So the tendency, of course, in our settings is if you have an emergency, call your neighbor, call a taxi, call a friend. Yet in well-developed settings, we just call 911 and everything is sorted from there. So my work involves trying to figure out how we can get a 911 system within Kenya, working through the Ministry of Health and the different county governments to see how we can establish a system within our existing healthcare infrastructure. As a starting point, I apologize for any background noise. I'm still in the office, and my office is smack in the middle of the emergency department, which is usually a marketplace. So I apologize for any background noise you may hear. I'll try and mute it in between the presentation. So my presentation today is, I was told this is a nice Goan community, and impressive by the community arrangement around that. Many people don't have this existing. And I'll be talking also between a 2-year-old and an 80-year-old. So I will try and just go through a couple of topics that I've asked to talk about that potentially is something that commonly happens just within the environment. And I'm happy to field any questions. Feel free to type it in the chat. It's a small group, so I'm happy to field questions and yeah, as we go along and maybe discussing something a bit more deeper in case you want to. Hopefully you can do this in an hour. A lot of it is video presentations. Then I'll just be summarizing the video presentations at the end. So we'll kick off the presentation with the first case. I don't know whether anyone can quickly guess what this patient is suffering from. You can feel free to type it in the chat, what you think he's suffering from. So it's an elderly gentleman. I'll tell you he's hypertensive, diabetic, on a cocktail of medication, and started having sudden chest pain, shortness of breath, and feeling a bit dizzy. Type in the chat. Let's see who gets it first as I play the next video.
He must score, surely! Oh. Hey, your pants are restricting your movement, right, John?
Simply to keep him in the game, John's heart and lungs are working at their limit. But
he must score, surely! Oh. Hey, your pants are restricting your movement, right, John?
simply to keep him in the game, John's heart and lungs are working at their limit. But by doing so, they're placing him in mortal danger. Blood is being forced faster and faster through his diseased coronary arteries. Flowing at 5 times their normal speed, blood cells eddy and swirl around his plaques. Bombarded by red blood cells, one fragile plaque is under unbearable strain. Its thin membrane is ripped open. Within moments, blood cells start to clot around the rupture. Anywhere else in John's body, this clotting response might save his life. But here, in his narrow artery, the effect is quite the opposite. The clot in John's artery traps more and more passing blood cells. It grows bigger, and the flow of blood to John's heart slows down. Downstream, the heart muscle cells are in peril. Their oxygen supply is dwindling just when they need it most. His starving cells send pain signals to his brain. But John has never experienced pain from his heart before. To him, it feels just like indigestion.
Do you eat your lunch too fast, John? Perhaps the old man's better off in gold.
He has no idea that this is the start of a heart attack. The growing clot is now blocking 2/3 of his artery. John's indigestion is getting worse. For the first time in his life, the regular beat of John's heart is under threat. A patch of 4 million muscle cells is running low on oxygen.
John, what's up? What's the matter?
5 minutes after his heart attack began, John's body is struggling to deal with the crisis. His brain has triggered a surge of the hormone adrenaline into his bloodstream. This is one of the most primitive and powerful reactions in the human body. Adrenaline arrives in his heart and soaks into its inner walls. The pacemaker begins to accelerate. John's heart is racing at 140 beats per minute, even faster than when he was running around. But now all its efforts are focused on its own starving muscle.
Call an ambulance.
But adrenaline can do nothing about the growing clot, which fills 90% of his artery. The supply of oxygen to his heart cells is down to a trickle. They are forced to shut down the function which absorbs most of their energy. They stop beating, leaving the rest of his heart to take up the slack. John's weakened heart cannot sustain its beat much longer.
We're just playing a game of football.
How's the pain now, John? Okay.
He loves football, John.
It's now 15 minutes since his heart attack began, and the flow of blood through John's artery is almost totally blocked. The heart muscle cells no longer have the energy to hold themselves in one piece. Their thin membranes are starting to leak.
You're gonna be okay, John. Just hang on in there.
John's injured heart is wearing itself out. Its beat is getting weaker. The effects are beginning to tell on the rest of his body. John is struggling to breathe because his lungs are filling with fluid. As his heart weakens, blood backs up in the vessels coming from his lungs. The extra pressure forces liquid out of his blood into the air sacs of his lungs. If the process doesn't stop, he could drown in his own body fluid.
Half an hour going on.
You must keep this on.
I don't know.
Nice, steady breaths now.
Just wasting time this. But I wanted to try.
Mate.
45-year-old male, possible MI.
See, here is Mrs. Actress. Like
Just
one
hold on,
time I
John.
saw her,
We're
I
nearly
saw
there.
her picture,
I'll sort you out.
but it's gone.
Hi, Maria. Kindly mute.
Gracie?
Yes?
Just mute your
The
video.
lack of oxygen in John's body is
I'm
beginning
trying,
to affect
but
his brain. He's
I
dizzy
don't know how
and
to do it.
disoriented.
I tried one. I don't know how to do it.
Time is running out for
Something
John.
about video, nothing to
His starved heart muscle cells are beginning to burst and die. If he's not treated within the next 20 minutes, his heart will be so badly damaged it will never beat normally again.
What's the story? John Palmer, 45-year-old. Collapsed with chest pains playing football. No past history, bit hypertensive. BP 90/50, tachycardia 120.
When did your pain start, John?
I don't know. They said about half an hour ago.
Don't worry, John. We'll soon have you sorted out.
Are you his friend?
Yeah.
Do you know if he's got a heart problem? Can you give his details to reception?
Right, let's do it quietly, quick as you can, please.
Okay, 1, 2, 3.
John is losing 500 heart cells each second, and unlike most cells in his body, they can never be replaced.
He's had a big anterior MI. We have to thrombolyze him. No contraindications, so let's give him some TPA.
By measuring the pattern of electricity in John's heart, the ECG locates the dying patch of muscle. Now his only hope is that his blocked artery can be cleared by a clot-busting drug, tissue plasminogen activator, or TPA. The TPA must reach the clot before so many heart cells die that his heart stops, and he dies too. John's heart muscle has been reconnected just in time.
Susie, hi, customer for you.
Only 500,000 cells have been lost. The survivors are starting to beat once more. His condition has stabilized.
All right. Yes, Lynette, congratulations. Yes, John was having a heart attack. So let me just move to the next slide. Yes. So we have a lot of patients who die from heart attacks daily in Kenya, and a lot of it is because of the increase in non-communicable diseases, your diabetes, hypertension, and sometimes it just runs in the family. So there are three main key things I think that you need to remember about heart attack. And the first and most important is being able to recognize the symptoms early. So that's the sweating, the chest pain or pain in the arm, neck, jaw, shortness of breath, some indigestion or heartburn. But in women, they get additional symptoms. So they get these symptoms plus additional symptoms like dizziness, some uncomfortable pain between the shoulder blades, unexplained fatigue, sleep disturbances. So if someone who essentially meets the risk factors starts having these symptoms, the first and most important thing is to recognize that they potentially are having a heart attack. The next most important thing is to get them to a hospital as quickly as possible. Because as you watch in the video, for every minute delayed, the heart muscles die. And the more heart muscles die, the worse your recovery period will be. And if enough heart muscles die, then you die. Yet there is actually treatment that is available that can reduce your chances of dying and also actually open up the blood clot in your heart. So first and most important thing, remember the symptoms. Two, identify the symptoms. Two, go to a hospital. Number three, and even way more important, go to the right hospital. Now, heart attack treatment is not treatment that's available in all hospitals across the country. The major private hospitals have heart attack treatment. I think Kenyatta, Coast General, Eldoret, MTRH also have heart attack treatment. So not every hospital has heart attack treatment. And one of the things we're trying to start identifying is which are the exact facilities. Because if you go to a hospital that's not able to identify you are having a heart attack and give you the appropriate treatment, then that trip to the hospital will not necessarily be that helpful for your situation. So going to the most appropriate hospital, the right hospitals, I said, or within Nairobi, the major private hospitals do provide heart attack treatment. The Kenyatta, I think, also does. Moi and Coast General also provide. So one of the key things is to figure out wherever you're staying, wherever you are, which is your closest facility that may be able to have heart attack treatment. So three things about heart attacks: recognize the symptoms that you've gone through. Know you need to rush to the hospital as soon as possible. This is when you call an ambulance to try and get to the hospital as soon as possible, and then go to the appropriate hospital and tell them you probably think you're having a heart attack, because then they need to act in a timely manner. So normally the treatment is available for until 12 hours, but even by 12 hours, your heart muscle. So within the first 4 hours, you actually at an increased risk of dying if you do not receive treatment. And the longer you delay treatment, then the worse your outcome will be. And that will probably lead us to the next patient. So if you don't get treatment in time, and again, something also we also commonly see is people who have sudden collapse, or what we call sudden cardiac arrest. And there are community interventions that have been put in place that actually can help people learn how to respond appropriately to someone who collapses suddenly. So the main reasons why people collapse: massive heart attack, big blood clot in your lungs, big blood clot in your brain will cause collapse. In some of these instances, the treatment provided by the bystander is actually life-saving. In the West, there's a lot of CPR training programs that are targeted to teach the lay people, and which is essentially anyone watching this video at this point who is not a trained healthcare provider, on what they can initially do while in the community and while ambulance help. And these initial steps actually can give your patient an increased chance of survival following sudden cardiac arrest. So the next video is a patient who collapses suddenly, and what you need to do when you see someone collapse suddenly.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest. Then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push at a rate of at least 100 beats per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR, but if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more, call 877-AHA-4CPR or visit heart.org/hands-only-CPR.
All right, so as I mentioned, sudden cardiac arrest is something that happens very commonly within the community. Where I work, we receive a lot of patients who've collapsed in their houses and are being brought in by the family behind their vehicle, which sometimes is, again, it's the best thing the community can do. And at the end of this video, we'll have a discussion about how to call an ambulance, how to call for help. We do have functioning private ambulance services, and hopefully one day we'll have functioning public ambulance services. But the key important part when somebody collapses, remember, when someone collapses is their heart has stopped working. So the heart has stopped working and it's not moving blood around. And your actions, you as a lay provider, even a healthcare provider, is to keep the blood flowing up until you can get to hospital where you can do additional things, or even the ambulance comes and they're able to do additional things. So the first thing is call for help. So call for help, call for an ambulance so that it's already coming by the time as you initiate the initial processes. I know this is the new one because people are worried about COVID and COVID spread. So the recommendation is place a towel or clothing over the patient's mouth and nose that prevents you from getting COVID, at least the spread of COVID from the patient. And then the most important thing is keep the heart beating. Okay, so putting your hands at the center of the chest, interlocking your fingers, and then pushing hard and fast at the rate of 100 to 120 beats per minute. And you just continue until the ambulance comes or you're able to get the patient to the hospital. We have received some people who have come in the back of a vehicle doing CPR, and I can tell you the outcomes are a bit better than those who just transport the patient to hospital. So if the patient has collapsed and they're not breathing normally, just start CPR. I know many people would be worried if, what if the patient is not completely out? It's okay to start CPR as long as you can confirm the patient has collapsed, they're not responding, and they're not breathing. Just start CPR. Okay, that's more important. That's probably going to keep them, give the patient a better chance of survival. and then get the patient again to an appropriate facility. And again, this is probably looking at your bigger kind of hospitals which have all the appropriate resources to continue your actions to ensure the patient survives. I've not included the use of an AED because they're not quite commonly available locally, and that's why my priority would be use that CPR, call an ambulance. Ambulances have AED and they know how to use them. So that's also very important because the ambulance also will come with an AED and they'll be able to use it. But you doing CPR gives your patient the highest probability of survival. And it's something as you're watching the video, it's quite easy to do and not really that hard to do, but just need someone to do it to give your patients a good chance of survival. I keep checking the chat if there's any questions, so feel free if you have any questions, put in the chat, then to see if there's anything. All right, off to the next patient. Any clue what this patient is suffering from? You can unmute yourself and say, or you can type in the chat. Looking at this picture, so 47-year-old female, known to have hypertension bound treatment. Apart from that, she's fine. Started complaining of a bit of a headache and then just got a bit more confused. Any ideas? And no silence. Don't worry. The Kenyan audience is always a hard one. Oh, here we go. Ah, yes, Elizabeth, patient's having a stroke, correct. Let's see.
Hello, in this health sketch, we want to talk to you about stroke. It's a bit of an odd name, stroke. It certainly has nothing to do with tennis strokes, swimming strokes, or brush strokes. The word stroke comes from the idea of receiving a strike or blow, as that is how quickly strokes appear. All of a sudden, people are struck by this illness. Did you know that every year more than 15 million people worldwide have a stroke? Of these, 5 million die and another 5 million are left disabled. Whilst most strokes occur in people over the age of 65, they can occur in much younger people too. But what exactly is a stroke? The brain, like all parts of the body, needs oxygen, which it gets from the blood. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged, and the symptoms that follow are called a stroke. As the brain controls the whole body, the symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs. Or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. The effects might be barely noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is so important to act quickly if you suspect a stroke. Remember, you need to get help fast. F is for face. Is their face drooping on one side? Can they smile? A is for arms. Is there weakness in the arms? Can they lift them both up? S is for speech. Is their speech slurred? T is for time. If you spot any one of these signs, then it's time to call an ambulance. Once the ambulance arrives at the hospital, a doctor will assess you and arrange an urgent scan of the head, which shows where the brain is damaged and what type of stroke has happened. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage, called an ischemic stroke, or a bleed, called a hemorrhagic stroke. The majority of strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by the buildup of fatty material in blood vessels. This fatty buildup may lead to a clot, which blocks the blood supply, just like in a heart attack. This is why a stroke can be thought of as a brain attack. A clot may occur within the brain, or it can travel from another part of the body, commonly the blood vessels in the neck. Clots can also travel from the heart, which may happen when you have an irregular heartbeat called atrial fibrillation, or AF. If a blockage stroke is detected within the first few hours, a clot-busting medication is sometimes given to dissolve the clot. This is called thrombolysis. If thrombolysis can't be used, other medications such as aspirin will be given as treatment instead. Bleeding strokes happen when a blood vessel bursts suddenly, causing blood to leak in or around the brain. In these strokes, blood on the brain can lead to swelling, a serious problem which may require surgery in some cases. Sometimes, stroke symptoms completely disappear in less than 24 hours. This is called a mini-stroke or TIA. Often, symptoms only last a few minutes, but just like with a full-blown stroke, you must go to hospital immediately if you suspect a TIA. This is because a TIA is a warning sign that you're at high risk of having a full stroke. Whether you have a TIA or a full stroke, daily medications are started and continued lifelong to help prevent further episodes. The effects of a stroke can be disabling, but given time, the brain can slowly adapt to recover some previously lost abilities. This is why stroke rehabilitation is so important. Rehab can be challenging, but many specialists are on hand to help alongside doctors and nurses. If your stroke causes difficulty swallowing, dietitians can recommend special diets or feeding tubes. If you have problems with communication, speech and language therapists can help. If it has become difficult to walk or perform daily tasks, physiotherapists and occupational therapists can offer exercises and home adaptations. Also, after a stroke, people often feel low or frustrated that they can't do the things they used to, and don't like being dependent on others. Counselors can help talk through these feelings, and many patient groups are available for further support. We've talked a lot about strokes, but what can we do to prevent them from happening? Even if you've already had a stroke in the past, there are many small steps we can all take to reduce our future risk of having a stroke, such as lowering high blood pressure, the number one cause of stroke, stopping smoking, lowering cholesterol, being more active, eating healthily, lowering alcohol intake to within recommended limits. If you have diabetes, keeping good control of blood sugar levels. In this health sketch, we've talked about what a stroke is, how to spot the key symptoms, and the need to act fast. We've also talked about treatments, rehab, and the steps we can take to prevent strokes. We hope this health sketch about stroke has been helpful for you and those around you. Health sketch, health for all to see.
All right. Again, something quite common, and I'm probably sure. I know they said over 65, but we're actually seeing strokes in younger and younger people at the moment. And this could be as young. I think I've seen a 45-year-old having a stroke. And again, similarly to a heart attack, the main thing involves blockage of blood supply to the brain and acting fast, recognizing the symptoms early. So the same principles of a heart attack, recognizing the symptoms early. So the symptoms is, again, facial droop, arm drift, unable to move one arm, unable to speak properly, or confusion. And again, noting that as soon as that happens, now strokes are less forgiving, like unlike heart attacks. So strokes, essentially, you need to be in a stroke hospital within 4.5 hours for us to actually give you appropriate therapy. In fact, much earlier, 3 hours would be a better timeline, because the longer you stay not coming to hospital, then the worse your outcomes are, because again, your brain cells keep dying for every minute you delay. So again, majority of the big private hospitals within Nairobi can provide you with stroke treatment. There's no public hospital that gives you stroke treatment at the moment. But the key thing, and one of the things that you really pick up, is the one and most important thing is that facility must have a CT scan. Okay, so one and key important thing is if the facility has no CT scanner, then the chances of it providing stroke treatment is like zero, because the CT scan is very important to help with the diagnosis, to make sure it's safe for us to give you the medication. So if you know any facility around you, if they don't have a CT scan, they can't treat your stroke. So, and again, this raises the need for us to know which facilities are around us that have CT scanners. And then, of course, the drug is available from major pharmacies. So maybe that's one of the things also that you also consider. But again, key important thing is recognize the symptoms early. Is there face droop? Is there arm weakness? Is the person having speech difficulties or confusion? Sometimes over dizziness is actually one of the severe dizziness and headache is one of the common symptoms you also see. And again, making sure that you actually get to hospital within 3 hours, preferably, and at least latest within 4.5 hours. Above that, above 4.5 hours, there are other therapies that are new in the market, and the kind of work. But remember, the more you delay, then the more brain cells that are actually dead. And so that's the important thing, is to get to a hospital as soon as an appropriate hospital as soon as possible. All right, so we've covered heart attacks, sudden cardiac arrest, strokes, and I said if you have any questions, feel free to just type it out in the chat. So the next case we're going to discuss is seizures. I'm sure you've seen, potentially seen someone having a fit, I've had someone having a fit. And so we're just going to watch a video of how to help someone who's having a seizure, to ensure that they're safe and not do all the crazy things I've seen people do when someone is having a fit.
I got loads of work for college and that. Nah, he wouldn't know any better. Besides, it has nothing to do with him.
Sid! It's all right, mate. It's okay. I know what to do. Right, just pop that into your head. There you go. Okay. I'm going to stay with you until it's over, okay? Just going to roll you onto your side, mate, so you can sleep it off. Said, I'm just going to tilt your head back, mate. There you go, just keep it there for me. You're all right, Zed. It's okay, mate. I'm with you.
All right. Yes, I think most people think a seizure lasts forever, and they think, yeah, if you're looking at someone having a fit on the ground, sometimes it looks like forever. But most of the time, most seizures will last just less than a minute or less. And again, this is behind the mechanism where the patient is to be. But sometimes patients have a fit, then do not wake up and keep having more fits without actually waking up in between. And these are the patients who need to be rushed to hospital and an ambulance is to be called. On this list, I'll probably start with the don'ts, because number one, don't put anything in the patient's mouth. Don't put your fingers, don't put a spoon, don't put anything in the patient's mouth. And yes, they will bite their tongue, but they will not eat it and they will not swallow it. It will heal, yes, but do not put anything inside the patient's mouth. And again, yeah, so don't try and pry their mouths open. I'm not sure who makes patients smell shoes and onions, but yeah, try not to make them smell that. Of course, do not restrain the patient. Main thing is you want to make sure that the environment they're in is safe. So put cushions, blankets, and stuff so that as they fit and they're hitting the ground, then they're hitting soft things. So you want to make sure that they are not injuring themselves further by hitting the ground or hitting hard objects. So you need to make sure that the ground is soft for them. Put their head, put something maybe under the head to stop them from banging their head on the ground. But do not try and restrain them. And wait for the seizure to end. It's probably going to just take a minute and then it's going to end. And then once they've ended, then you will need to put them on the side. Now, the important part about putting them on the side is because there's a tendency sometimes they may vomit. If you're lying flat and you vomit and you're unconscious, then you're going to choke on your own vomit. So the main thing is for you to have them lie on the side so that if they vomit, then the vomit just falls onto the ground That's the rationale behind turning them to the side and make sure the head is open and turn to the side. So in case any vomit comes out, it pours off the ground and then they don't choke in their own vomiters. And again, don't give them something to eat, or don't put anything in their mouth until they're fully awake and able to do it for themselves. And then, yeah, don't try and shove drugs into their mouth. Key thing is, of course, try to prevent a fall. Do not let them just drop down and injure themselves further. Make sure they're in a safe area, clean the area of sharp objects and anything that can injure themselves. Cushion the person's head, as I mentioned. Loosen tight clothing, especially around the neck, to allow easy blood flow to the head. Turn them to the side, as I mentioned, so to allow vomiters to come off. And then you stay with the patient. If the patient is not waking up, you probably want to call an ambulance, because if they're not waking up, there's a high tendency they may start having another fit. So the sooner the ambulance is on the way, the better, so they can pick them up. And if the patient is awake again, they may need to seek professional help, go to hospital, especially if it's something that has recurrent or they're known to have seizures. But yeah, so nothing really to panic about. Most of them do quite well. They get injured because we're trying to injure them ourselves by restraining them, by shoving stuff up their mouth, or yeah, not protecting them, but mostly they will be fine. And then at the hospital, they'll be able to then figure out what next to do with them. All right, that's the do's and don'ts of seizures. Yes, the next thing we're going to look at is bleeding. I think this is common, where it could be a household one. So those ones are normally, I think, they're able to control a small bleed in the house. But there are some situations, especially maybe like road traffic crashes or something massive happening, and you get some major gash or some assault and there's significant bleeding, then this needs to be controlled in a professional way. I'm sure we're all happy to control the small bleeds that we get. All right, so let's see how this is done.
When bleeding is severe, it can be traumatic and distressing. If someone's bleeding isn't controlled quickly, they may develop a life-threatening condition called shock, and they may become unresponsive. Bleeding from the mouth or nose may affect their breathing, so try to ensure that the airway is kept clear. An obstructed airway can be a cause for a casualty to become unresponsive. If the casualty becomes unresponsive at any point, open the airway and check their breathing and prepare to treat an unresponsive casualty. To treat someone with a severe bleed, put gloves on if you have them, as this will help to protect you both from infection. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it in and apply pressure on either side of it to push the edges together. If there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Jenny, can you apply some pressure for me, please? Brilliant, excellent, well done. Ask a helper to call 999 or 112 for emergency help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. The casualty may develop shock, so help them to lie down on a blanket or rug if there's one to protect them from the cold. Raise and support their legs so they are above the level of their heart. Do not raise the leg if it is injured. Jenny, could I lay you down? Excellent. Just going to lift your legs up. Is that okay? Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. So just going to apply this dressing to the feet. Okay. Want to take your hand away? Well done. Okay. Can you hold up for me? Excellent. Okay, can I have this? Okay. Check the circulation by pressing a nail bed or skin beyond the bandage for 5 seconds. Release the pressure, and if the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. Okay, can I have this? Okay. Okay, excellent. If blood shows through both dressings, remove them and apply a fresh bandage, ensuring there is direct pressure applied at the point of bleeding. Support the injured part with a sling or bandage, but check circulation every 10 minutes. Keep monitoring the casualty's level of response while waiting for help to arrive. So remember, when treating severe bleeding, wear gloves if available. Remove or cut away any clothing from around the wound. Check for objects in the wound, but don't remove them. Apply pressure on either side of the wound. If there is no object in the wound, use a dressing or pad and apply direct pressure to the wound. Call 999 or 112 for emergency help. Secure the dressing with a bandage. Treat the casualty for shock. Support the injured area. Keep checking their level of response while waiting for help. And that's how we treat someone with a severe bleed. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Yes, first aid does save lives. And so just to recap, the main thing, again, as I mentioned, most of this probably is not in your house, but sometimes could be secondary to assault or a traffic crash in a vehicle and there's an accident and someone is bleeding massively. We've seen a lot of patients die on the road just from bleeding because no one wants to stop the bleeding. The key thing is, number one, apply direct pressure on the wound, get a piece of cloth. And this is why sometimes that's why we insist that you have a first aid kit in your vehicle or a first aid kit in the house, because then your gloves and bandages are normally inside the first aid kit. So apply direct pressure on the wound, apply direct pressure on with one hand, both hands, using a gauze bandage. And if it's not working, then you want to apply dressing inside the wound and then, if it's next to the wound, and apply more pressure. Tourniquets, essentially, a tourniquet there's a commercial version of it. But if you're actually taking a piece of clothing and tie it just above where the bleeding is coming from and tie it as tight as possible to stop the bleeding and making sure you tighten it until the bleeding stops, that's a tourniquet. And just what you need to record is the time that the tourniquet has gone in place, because a tourniquet can be put in place for at least 2 hours before we need to intervene and look into it. And that time, of course, you should have gotten to the hospital. So a tourniquet, as I said, you can get a commercial one, but just taking a piece of cloth and tying it above where the bleeding is coming from and just wrapping it tight and twisting it until it's tight enough to stop the bleeding, that's good enough. For you to stop the bleeding. Lucas has a question. Okay, actually a couple of questions. Elizabeth, what are the most important items to have in a first aid kit? Definitely gloves, gauze. Gauze are those boxes of like square kind of pieces of cloth that we use to apply on wounds, and there are lots of those. Then there's the triangular bigger bandage that we use, or the roll bandage that we use to tie around. So that's important. A pair of scissors. A pair of scissors is very important. Very good scissors within the first aid kit. You could have antiseptic solution if it's available. You can have an antiseptic solution. The others are painkillers, essentially, a set of Panadols or something just for pain sometimes. I think I would say that I'd prioritize those, because most of the things you're able to handle at the ground level is bleeding. And bleeding involves using loads of bandage, gloves, and of course, you don't want to get your hands contaminated. In the COVID era, probably would be a good idea to also have a face mask in the first aid kit, because then that helps you protect yourself. And then lots of bandages, some antiseptic solution, a good pair of scissors, because you may need to cut off clothing around the victim's clothes, and then again, then the other stuff, elastoplast and the others are also good to have. But I think those are the most important to potentially have in your kit. Colleague of mine, this is from Lucas, collapse in the office, is diabetic. What do you think influenced this? Diabetics not well controlled, or sometimes it happens, you miss a meal or two, then they tend to have low sugars and they will collapse. Most of them are potentially not fully out when they collapse. They just collapse and they get to the ground and they're semi-lucid or so. And yes, so it's not normal for diabetics. It's actually not normal for anyone to collapse, but diabetics sometimes get low blood sugar levels, and it's because maybe they took the medication, skipped a meal, or took the medication is not well controlled, so they tend to end up with low sugars. And if this happens again, if they're non-diabetic, number one, don't unless they are fully awake, don't feed them, okay? Because they'll choke on whatever you're trying to feed them out. If you have sugar, you can take your sugar granules and on the cheek, on the side of the cheek, the buccal cavity, so inside the mouth, just put some sugar in there. And I'd say glucose solution, but I know none of us is hanging around with some glucose solution. So some sugar and put it there. The good thing about the sugar is, number one, it will potentially it will be absorbed from that position, the buccal cavity, but also, of course, will not cause choking. And of course, don't put like too much sugar, just a small spoon of sugar, teaspoon of sugar or something, just on the side. And then as soon as the patient is awake, they need to eat. Otherwise, they'll be collapsing again. So make sure as soon as they're waking up, they eat to it. So diabetics, yes, it's quite common for them to have low sugar collapses. And ideally, most of the time, they're not fully out. They're just dizzy, and some sugar on the side of the cheek should be able to sort that out. If they're not waking up, please rush them to hospital, because then the problem. But yeah, I rarely do diabetes just collapse suddenly, unless the sugars are low. All right, we're getting to more hairy situations where we have road traffic crashes. And I think this is one pandemic we need to talk about in this country, because it kills way more people than COVID has killed in the last 1 year. And just something, and a lot of it is potentially preventable through prevention measures, but also a lot of people die because we do not have rescue systems, and people just die on the road, like roadkill, because there's no ambulance system. And as you can see, most of the time people are just watching once they are not really helping. So it's also important that people learn how to help people who have been in traffic crashes. So let's watch that.
When an accident happens, ensure the accident scene is safe. Call for help immediately. If the victim has a helmet, remove it carefully. Always protect the victim's neck to prevent further injury. To stop any bleeding, apply pressure to the bleeding site and elevate the affected arm or leg. Immobilize any broken bones to reduce pain and prevent further injury. To carry the victim safely, get help to support the victim's head, neck, back, and legs to prevent any unnecessary movement of the neck and back. Did you know? The Constitution of Kenya of 2010 and the Health Act of 2017 guarantees you the right to emergency medical treatment. All public and private health facilities have a legal duty to provide you with emergency medical treatment. Any health institution that fails to provide emergency medical treatment despite having the capacity to do so could face conviction and fines up to 3 million Kenyan shillings. The Injury Prevention and Safety Initiative, or TIPSI, brings together local healthcare professionals to improve injury outcomes in Kenya by providing guidance to stakeholders on the emergency medical aspects of injury. For more information, check out www.emergencymedicinekenya.org/TIPSI or follow us on Twitter @TIPSI Kenya.
Yes. So key thing is number one, safety. In any first aid situation, whether it's in your house, in the neighborhood, out on the streets, your safety is number one. If you're not safe, do not even attempt to try any first aid. You can't help someone, you're dead. So your safety in any situation is always the number one thing that needs to be emphasized. And even on road traffic accidents, so ensuring the scene is safe and other road traffic users are not coming to crash into you is the first and most important part of it. And then the next thing, of course, you need to call for help. So I'll tell you where to get all these numbers on how to get an ambulance. And so you need to call an ambulance. Helmet removal. The main thing is, again, borders are in too many accidents. And yes, so knowing how to remove a helmet. The key thing when you're removing a helmet is just making sure, as you can see, you need two people. One protecting the patient's neck and stabilizing, holding the neck in place, as you can see what that person is doing, holding the neck in place, and the other one maneuvering out the helmet to get the helmet out, but making sure the neck is protected at all times. And the other part of it, of course, making sure the neck is always being protected, because most likely they may have broken the neck, and they may then end up being paralyzed and all the other things that comes from breaking your neck. And so ensuring that is protected at all times. The other part of it is, of course, stop any bleeding. The same way we're watching the other video, apply pressure, put a bandage on top and make sure there's enough pressure to stop the bleeding, and then elevate the limb to reduce the bleeding. And then any broken bones, put them together, splint them. So tie them together like that. Maybe that's a broken leg there. So he's just tie them to prevent the movement. Broken bones, they're quite painful if they keep moving and they're not immobilized, but also more other big thing is they continue bleeding unless they're immobilized appropriately. So always watch out for that. And most importantly, we carry people like they're sacks of potatoes in an accident. And I'm sure you've all seen this, as they bundle them up behind a police pickup or behind someone's car. The main thing when you're carrying a victim is, again, you want to keep their back as straight as possible. And so you need multiple people. Keep the patient's back as straight as possible. Protect the patient's neck. And again, so this person is holding the head to avoid the neck or head falling backwards. So that you're keeping the whole patient straight. Again, this is protecting for their back, as you do not want to cause more injury moving the patient. Worse off than they actually got from their primary injury in the vehicle. So key important things is that, and making sure then you get you get the patient to a hospital that is able to do surgery. They have a theater, because then especially when they need emergency surgery. All right. So this last presentation is actually not first aid. So I find it's a cool video about keeping healthy and trying to prevent yourself from getting any of these conditions, your heart attacks, your strokes, and it's a nice video from Michael Mike, and I find it quite interesting. Again, if you have any questions, I'll be taking questions at the end of this, and also you can type them out in the chat.
Hi, I'm Dr. Mike Evans. Usually I'm talking about the science behind best health, but today I want to start a movement called Let's Make Our Day Harder. I know that sounds counterintuitive. In fact, usually I'm asking, how can I make it easier to do the right thing? But let me explain. A recent review in JAMA Internal Medicine compared the health of baby boomers to previous generations. It showed what you might expect. Medical advances have led to longer life expectancies. But it also shows something else. U.S. baby boomers have more chronic disease, more obesity, and lower self-rated health than members of the previous generation at the same age, even though we smoke less and work out more than the Mad Men generation. So what's the difference? Well, I think for a variety of reasons that include technology, culture, and attitudes, we have a severe generational case of sitting disease. We watch phones, tablets, and TVs. We stare at computers while we work and pride ourselves on not moving for 4 hours straight. We don't walk to a friend's house or a coworker's office. We text them. I text my kids in my own house. Don't get me wrong, I love technology. There's lots of good to be had, but I also think we need to be mindful that as technology becomes more ubiquitous, it can loot the medicine chest of our single best treatment for good health: being active, moving. We shop on the internet instead of walking to the store. We have vacuums that automatically circulate so we don't have to. Electric toothbrushes so we don't have to move our hands up and down. With the push of a button, we can manipulate the TV, the music, the temperature. We might even choose our house based on these conveniences or on the size of the TV room or garage, not walkability. Living further away gets you a bigger house, but it can also mean another half-hour a day of sitting in your car. To compare ourselves to the recent low-tech, simpler past, let's look at the Amish. The average Amish dude walks 18,000 steps a day. The average Amish woman, 15,000. American men walk 7,200 steps a day and women 5,200. In Canada, we're a bit better, and I actually find these numbers a bit high, but 2009 data show 9,500 steps per day for men and 8,400 for women. Unfortunately, this drops by about 1,500 steps a day once we hit 60. I think it's time to change our prevailing attitude. Maybe easier isn't really better after all. So how's about you and I start a movement? An anti-pushing the button so the door opens automatically for us movement. I'm not talking about extra stuff like going to the gym or running. If you do that, it's great. I'm talking about the health gold of our daily habits, what I call tweak the week. It's about looking at your week and seeing where you can make it harder by taking the stairs or riding your bike or getting off a stop early on your daily commute. Have a walking meeting instead of sitting in a conference room. I had a 90-year-old patient tell me the other day that he gets off 2 floors above his floor. When I asked him why, he said, well, I can't go up the stairs too well anymore, but I can still go down. Can you flip technology and use your phone or other wearable to monitor and remind you to move or stand more? How about going for a walk at lunch instead of just going somewhere else to sit? Can you reframe buying a push mower or a rake or a snow shovel as an opportunity? Instead of driving around the parking lot for 10 minutes trying to find that spot that's 10 feet closer, can you just park farther away in that spot reserved for people who want to live longer and have a higher quality of life? Let's rethink this a bit. Let's you and I and our loved ones and our coworkers and our friends, let's all mix in a little low-tech into our high-tech. Let's do something that's totally in our control. Let's make our day harder.
All right, some questions. Doctor in Kenya, what's the average response time for an ambulance? This depends on where you live. The main ambulance, the E-Plus ambulance base is in on Mombasa Road, but they have ambulance based spread across the country. And there's another one called Rescue, which is also has ambulances a bit spread around the city. So on average these days, we probably will get a 15-minute response. They'll probably be there within 15 minutes. Yeah, within the city, you should be able to get an ambulance within 15 minutes. Out in the rural areas and out of Nairobi, that may vary significantly. And faster, most importantly, trying to figure out who to call, because again, they're not very well organized outside the city. So that answers that question. But there are ambulance companies, and that's one of the projects we're really trying to do, and that's explained in this video.
Do you know what to do in a medical emergency? The Emergency Medicine Kenya Foundation has developed Casualty, an app for both healthcare providers and the public that helps you access life-saving medical care information when you need it the most. For members of the public, you can call an ambulance, get first aid information, and locate the nearest emergency care center at the tap of a button. For healthcare providers, Casualty provides you with current emergency care treatment guidelines to help you manage even the most critically ill patients. The app also allows you to pick your own hero profile and personalize it to meet your needs. Casualty also features an offline extensive database that helps you prepare for the next time you need to save a life. Download the Casualty app today to save a life tomorrow. Casualty app brought to you by the Emergency Medicine Kenya Foundation.
Yeah, so we developed the Casualty app, and there are many apps out there, but what we have on the Casualty app is, so it has information on all the first aid stuff you watched, and then there's videos there that you can keep watching and learn what to do even real time in case you come across something, but the videos will need data for that at that particular point. We put in the ambulance and easy access ambulance numbers. Again, sadly, these are private, but as we develop the systems on the ground, we'll keep improving and providing that information. Because for us, the main important thing is to get everyone to access emergency care as soon as possible and potentially save that time and get them to the right place also, so they can receive that emergency medical treatment to save their lives. I know the question we get asked a lot is it available in the App Store? No, not yet. We'll probably get in there next year. We just launched this year, so it's only on the Play Store at the moment. We'll get on the App Store for those with Apple devices. All right, and that ends my presentation. I'm happy to take questions. Guessing there are no questions.
The community is very shy, so probably won't get questions. And but if there's anybody who wants to ask any questions, please feel free to do so, or just type them out. While we wait for that, I just again wanted to say thank you so much to you, Benjamin Wachira, and for everything you've done for Kenya. I mean, it's amazing that you're tackling our lawmakers, and I'm very happy to know that now it's law that if there is an emergency situation, it's illegal for you not to be given treatment, because I have a personal situation where my brother was denied emergency care during an accident, but this was years ago. So I'm glad that that law has changed. I've learned a lot from this. For example, with the fits, I was always of the opinion you had to put something in the mouth. So I'm glad to know that you're actually not meant to do that. Another thing that has come out of it, it's very important for all of us to have a first aid kit at home. Please invest in one. If you don't have to buy the fancy stuff, we can just have a box and put all the stuff that Dr. Wachira has told us, because it could come in handy. Everyone should have one in the car. I think is it law, Dr. Wachira, to have a first aid kit?
Yeah, it's law, but I'm not sure how well it's enforced. Yes, you probably need to just have it for your own good.
Exactly, it's for your own good. So any other, I see there's a question that has come in from Nisha again.
Yes, no, we're not doing mouth to mouth. We're not doing that anymore. Yes, there's no benefit from mouth to mouth resuscitation. Just do hands on a CPR.
Okay, that's good to know. Especially with COVID, it's not necessary to do mouth to mouth. Any other questions are most welcome. Maybe the other thing, Dr. Wachira, is if there are any other questions, perhaps we could put them across to you after this talk, and we'll post them on the community forum. The other thing, guys, is please download the app. We'll be waiting with bated breath for the iStore to provide, or is it the App Store for Apple phone users to have it? But for anybody else who's using Android, is it Android? Please get the app.
Ask for people who are on Android. Yeah.
It's not, please, we can talk about Samsung being more expensive than iPhones, but thank you again. And I wanted to thank you on behalf of, again, the Goan Institute and the chairman, who is somewhere representing the community in the safari rally. Again, this is so important for the safari rally. So your information is very handy for what to do in case of an emergency. But thank you again, and thank you for what you're doing for Kenya and Africa. And if there are ways we can support you to bring more health care for emergencies to the rest of the community, please do. We'll support you all the way.
Thank you very much. Really appreciate, and it was good to share some of this information. I think for us is the more people who know this information, the better, because then we can save lives. And remember, sometimes you think it's just you for your own sake, but sometimes my own relative may be somewhere near someone who knows fasting. So emergency care affects all of us, regardless of where you are in the society. And that's why it's important that we all know what to do in case of an emergency.
Absolutely. Thank you so much again. And we might call you back again, for another session.
Not a problem.
Thank you. And thank you everybody who made time to attend. I hope it's been informative. I can see a lot of people have said they were very informed. I'm sure the video will be made available to the community. So in case anybody missed out, they can watch it. And please watch it again, because you just never know. There are many times we find ourselves in the situation where we have no idea how to react when one of us collapses or there's a heart attack, or just watch out for the symptoms. So please watch it again. Thank you so much again, and God bless you all. Thanks. Bye.
Thanks, Lynette, and thank you everyone. Goodbye.
Bye.